As far as diagnosing or figuring out if somebody has sepsis, there is unfortunately not one single perfect test for this. We really rely significantly on your symptoms. We actually have developed a memory device to help us and to help patients understand those signs and symptoms of sepsis. The first S in sepsis would be for shivering. If you're having shaking chills or fevers, that certainly may indicate an infection or sepsis. The E is for extreme pain. I'll often hear patients say, "I've never felt worse in my life than at that time." The P is for pale or discolored skin, and a lot of times we'll hear the family members will notice that they feel like one of their loved ones looks very different, that they seem very pale. The next S stands for sleepiness. And again, that's something we often hear more from family members, that people don't seem to be thinking correctly or they seem to be sleeping progressively more each day. The I stands for I feel like I might die, or we would call that impending doom, and that is something we take very seriously when patients tell us. And finally, the last S stands for shortness of breath. It's a very common feature in patients with sepsis to have difficulty breathing. If you're experiencing any of these symptoms, especially in the setting of infection, you want to contact your healthcare provider immediately. When you speak with your healthcare provider, they will likely want to talk to you and see you in the office, and they will talk to you about these symptoms that you may be having. They will then do a full examination to see if they can see any issues related to the sepsis. They'll be taking what we call vital signs, and these include your temperature, and they'll be looking to see if it's either high or low, both which can be seen with sepsis. They'll be taking your pulse, which is often high in sepsis, but certain medications or conditions can make it so that you don't have an elevated pulse rate. They'll be looking at your breathing rate, which may be very high with sepsis, and they'll be checking your blood pressure. That can sometimes be normal or high, but if it's low, it may be a sign that very serious sepsis is present. They will also do a whole body exam looking for where that infection may be located. In addition, your healthcare provider may want to order specific laboratory tests. We can measure that level of your white blood cell count to see if perhaps an infection is present or if your body is reacting to that. They may also look at tests that evaluate your kidney, your liver, and even your heart. There is a special test that we will measure called a lactate, and this measures a specific type of acid that can be elevated, especially seen during times of sepsis. In addition, they may want to obtain cultures from blood and from skin, from your sputum, or from your urine that may indicate where the infection is located. Finally, they may need to do special x-rays, such as a chest x-ray or even a CAT scan, again, to try to help find out where that source of infection lies. When we start talking about treating sepsis, one of the biggest things we want to emphasize is that the treatment for sepsis really does occur in the hospital. We know that many disorders and diseases can now be treated as an outpatient, and certainly certain types of infection can be. But if someone truly has sepsis, that does need to be treated within the hospital itself. One of the first things that will happen when you come in the hospital is that they will administer antibiotics for a suspected bacterial infection. In addition, we may want to also administer specific antiviral medications or antifungal medications if either of those are suspected. Those are typically given through an IV initially, and then eventually, when things start getting better, changed over to an oral tablet. The duration of therapy may be anywhere from 3 days to as long as 6 weeks worth of therapy, and it is very important that you finish the entire course as prescribed. Other specific treatments for sepsis may include IV fluids. People will often get IV fluids when they come in the hospital, but during treatment for sepsis, these become especially important to keep your blood pressure normal. Patients will often receive several bags of IV fluids even during their very first day or first hours in the hospital. Sometimes surgery may be needed to treat the infection, particularly if it's an infected appendix or infected gallbladder. Those may need to be removed. Sometimes skin or tissue underneath may actually need to be cleaned out or removed if the infection starts there. In extreme cases, patients may need to be transferred to the intensive care unit where they can receive help with their breathing by a ventilator machine or perhaps help with their kidneys through something called dialysis. There are specific medications that can only be given in the intensive care unit to raise the blood pressure if when you come in your blood pressure is quite low. In addition to this medical therapy, there are additional resources that are often needed. Many people will need supportive care with things such as occupation or physical therapy. They may need nutritional counseling and certainly may need social service consultation to help with support after discharge. We'll often find that patients will benefit from psychological consultation, as the treatment for sepsis and the time in the hospital can often be a very stressful experience for many patients.